Hi guys, it's Dr. Madray from Progressive Pediatrics, and I'm going to talk to you guys about nosebleeds today. So nosebleeds are very, very common. Why is that? So first off, it's the way that the nose is made. So the nose has a large blood supply, and we have about 5 blood vessels that give off little, small, tiny blood vessels called capillaries, and they all meet together at one part in the front of the nose. On top of those blood vessels, we have very, very thin skin in the nose as well, which is just a setup for a disaster. So what are some things that cause nosebleeds? So nose picking is one of them, just causing the direct trauma to that thin skin and all the blood vessels in the nose. And the other reasons are also why it happens so frequently in the wintertime. The skin is very thin, and once there's cold, dry air outside, and we have dry heat that's heating our houses, that just causes intense dryness and the skin breaking, so we have more nosebleeds in the wintertime. What do we do when we have a nosebleed? So the first thing we want to do is we want to take our fingers and we want to pinch our nose. Not the hard bony part in the middle, but we actually notice the soft part right underneath the bone. We take both of our fingers, press down, and hold pressure on there for 5 to 10 minutes. If you do it any sooner than that and release the pressure, then it can actually start bleeding again. So once you put down the pressure, you don't want to tilt your head back, because then all of the blood is going to drain to the back of our throat and kids can actually aspirate it and choke on the blood. But what you want to do is pinch, and you can lean forward at the waist a little bit. You don't have to tilt your head forward either. Just stay straight and tilt forward so the blood will come down. You can always use a washcloth or a tissue just to prevent any messiness. When do you call us at Progressive Pediatrics? If you're holding pressure on the nosebleed and it won't stop for longer than 10 minutes, if you notice any small minor cuts that are bleeding for a prolonged time, or if your child is having nosebleeds more than once a week. So what are some ways we can prevent nosebleeds? The first would be nose picking. There's no way to completely stop your child from nose picking, especially in our very stubborn toddlers. So the best thing we can do is to make sure their nails are cut or filed down to prevent the actual trauma in the nose. The other things we can do are focused on moisture, because a lot of the dryness and the dry skin is what causes the nosebleeds. So we can use nasal saline, the saltwater spray for our noses, and also one of the big ones is if you take some Vaseline, either on a Q-tip or with your finger, you can put it on the inside of your nose in the front, just around there, especially before bedtime when we have a lot of dry air. Other ways we can help with the dryness and the moisture is to have a humidifier on in the house, as well as just taking steam showers to get that moisture in our nose, especially before bedtime. Remember, if you have any questions or concerns, always feel free to give us a call, and one of our providers will be glad to answer any questions you may have at Progressive Pediatrics.